This is an image of someone taking their blood pressure. Resting blood pressure and heart rate. An extremely important aspect of your care is to control your blood pressure and heart rate to avoid unnecessary stress on your aorta. You should monitor your blood pressure and heart rate at home. You can buy a monitor from a pharmacy or online. Choose one that uses an upper arm cuff, not a wrist cuff, and one that is certified for medical use. It is important that you choose one with a cuff that is the correct size for your arm, usually expressed as the circumference of your arm. Cuffs which are too big or too small will not give a correct reading. For further information, the American Heart Association produces guidelines for validated blood pressure monitors. See the resource section at the end of this patient guide. Typically, the recommendation after an aortic dissection is to aim for a resting blood pressure of 120 over 80 milligrams of mercury and a resting heart rate of 60 to 70 beats per minute. If your doctor gives you a different target for your case, you should follow that recommendation. Typically, the recommendation after an aortic dissection is to aim for a resting blood pressure of 120 over 80 mmHg and a resting heart rate of 60 to 70 BPM. If your doctor gives you a different target for your case, you should follow that recommendation. To start with, take your blood pressure a few times a day, but don't do it too often and cause yourself worry. When you take your blood pressure, it is best to take 3 readings at each session and record the average. To obtain meaningful readings, you should rest first for 5 minutes, be fully relaxed in a sitting position, and have no stimulants such as coffee or cigarettes beforehand. Keep your legs on the floor and do not cross your legs. Further advice can be found under blood pressure in the resource section at the end of this patient guide. Your blood pressure will change depending on time of day, what you are doing, and what medication you have taken. This is completely normal. However, if you are regularly getting readings significantly above your target blood pressure, you should talk to your PCP. To get your blood pressure well controlled, it may take some months and you may need help from your PCP to adjust medications. Once you are confident that your blood pressure is controlled and you are achieving the target figure, you can reduce the amount of self-monitoring that you do. It is best to still check your blood pressure every day. If your blood pressure or heart rate becomes too low, you may feel dizzy, faint, or fall over. First, check that you are not dehydrated, as this can cause low blood pressure. Drink a glass of water if needed. If you're still concerned, consult your PCP. It is possible that your medication may need adjusting. Quote, focus on the step ahead instead of the whole staircase. John P.